The Agency for Healthcare Research and Quality developed training materials for healthcare systems and professionals to put research results into practice. Additionally, the Agency for Healthcare Research and Quality generates measures and data used by policyholders and providers. So the AHRQ has started to work on some of healthcare's greatest challenges, including reducing antibiotics overuse and eliminating healthcare associates infections, improving care for people with multiple chronic conditions, and also incorporating the latest research findings into electronic health records to facilitate clinical decision makings and discovering how to better provide or to help provide opioid addiction treatments service in rural communities. Individual health records are a rich source of data because an individual patient, however, it is not easy to see trends in a population of patients by looking at the individual record. To reveal patterns, data must be extracted from the individual records and entered into a database. And these data may be used in a facility specific or a population-based registry for research and improvement in customer care. In addition, they may be reported to the state and become a part of the state and federal database that's used to inform health policy and improve health care. The National Practitioner Data Bank, which they call the NPDB, provides an electronic information repository of medical malpractice payments, adverse license actions, and certain professional review actions such as denial of medical staff privileges taken by healthcare entities such as hospitals against a physician, a dentist, or other healthcare providers, providing accrediting organization and peer review organizations. These are specific federal laws when we talk about the National Practitioner Data Bank. There are federal laws that identify who may report offenses to the NPDB and who may query results from the NPDB. These laws identify actions that must be reported to the National Public Practitioners Data Bank, and the laws require healthcare facilities to query, and they query this data bank for privileges, credentialing, and re-credentialing purposes. The data bank provides data specific to an individual healthcare practitioner for these particular purposes. This is particularly helpful to healthcare facilities when a healthcare practitioner has lost his license to practice in one state, and then he decides, or she decides, or they, to move to another state to practice. Previously, the healthcare facility would have been unaware of the action against the healthcare practitioner from the other state. But because of this data bank, it makes it easier for them to be able to access that information. The AHS Office of the Inspector General reports to the NPDB and names of those who are excluded from the Medicare and Medicaid program. The public uses this data file are sorted by individual provider type, so the organization, the federal agency, state agencies, and health plans. Healthcare delivery system, they utilize quality metrics as benchmarks and daily practices. And although there's no single standards for the data quality in healthcare, data must follow accepted standards of practice. And so AHIMA published their statement of quality healthcare, and their statement pretty much talks about the quality of healthcare data and information, which documents must position or must be positioned as healthcare data and its transformation into meaningful information. So this information should be a central concern for consumers, for healthcare providers. It should be a central concern for the healthcare industry and the government. Standards, technologies, education, and research are required to capture, use, and maintain accurate health care data and facilitates the transition from paper to electronic systems. So in figure 4.4, it shows the data quality management model, which includes the DQM domains that's associated with data integrity characteristics. The DQM model was developed to illustrate the different data quality challenges. So in the next slide, we're going to go through those domains. So one is application, and this is the purpose of the data collection. The process by which data elements are accumulated. Warehousing, the process and system used to archive data in data journals. Analysis, the process of translating data into information utilized for an application. Accuracy, the extent to which the data are free of identifiable errors. Accessible, data items that are easily obtainable and legal to access with strong protection and controls built into the process. Comprehensive, all required data elements or items are included and ensures that the entire scope of the data is collected with intentional limitation documented. Consistency, the extent to which the healthcare data are reliable and the same across applications. Currency, the extent to which data are up to date. A datum value is up to date if it is current for a specific point in time, and it is outdated if it was current at a preceding time but incorrect at a later time. Definition, the specific meaning of a healthcare related data elements. And then there's granularity, the level of detail at which the attributes and values of healthcare data are defined. Granularity is the level of detail, and I already talked about that one. And precision, data values should be strictly stated to support the purpose. Relevancy, the extent to which healthcare related data are useful for the purpose for which they were collected. And then timeliness, the concept of data quality that involves whether the data is up to date and available within a useful time frame. Timeliness is determined by the manner and content in which the data are being used. Let's talk about primary and secondary data sources. So they are categorized as either primary, when we talk about primary, or aggregated data, right? The healthcare record consists entirely of patient-specific identifiable data, so it's considered primary data. Aggregate data also refers to secondary data. This includes a compilation of information on groups or people or patient that does not identify any particular patient. So the health record is considered a primary data source because it contains specific specified data and information about a particular patient that has been documented by a professional who provided the care. In healthcare settings, electronic systems store the data. Most electronic health record system contains automated databases that contain secondary data, making the need for manual data collection obsolete. So this automated secondary database replaced the historically known disease database, such as for diabetes or trauma. A database is an organized collection of data, text, reference, or pictures in a standardized format, typically stored in a computerized system for multiple applications. Data sets were developed for a variety of healthcare settings, first of which were acute care, long-term care, and ambulatory care. Standardized data elements and definition makes it possible to compare the data collected at different facilities. For example, the American Joint Committee of Cancer, the AJCC, Collaborative Stage Task Force developed a standardized data set entitled Collaborative Stage Data Set. And another data set that is widely used in cancer staging, which is described as the degree to which cancer may spread, along with the severity of the patient's cancer for the original tumor. This is also known as the primary tumor. The cancer staging scale is a universal scale used in the medical community and assists the collaboration of patients' care plan among multiple physicians. So key components: assess permission, which defines and enforce access to data. Data dictionary exists, and each data element is defined. Standardized format, use a standardized format to ensure consistency. State and federal laws, all laws, regulations, accredited standards, and policies are followed. And then there's data integrity. They implement policies and procedures throughout the patient's encounter to ensure data integrity. So this ends this part of the session.